Hey YouTubers, it's Regina. It is Thursday, December 23rd, and this is week 8 post-op tummy tuck and week 80 or 81 post-op lap band. Yesterday was my official 8 weeks, but I had an appointment with my lap band surgeon today, so I thought I would combine the two. I worked last night. My appointment was for 9 a.m., so pretty much I've been up for, almost like 20 hours or something. It's noon on the East Coast. So what's going on? My tummy's great. Still random contractions, muscle spasms that are probably similar to a Charlie horse, but not as intensely painful as a Charlie horse, but very similar. I continue to use the Scar Away silicone strips as well as the Kilo Coat gel when I take off the strips. You have to take off the strips every 12 hours and wash them. They're reusable. You throw them out after 7 days. So I'm still having that itchy, burning, pulling feeling in 2 areas of my incision, and that's usually a sign of a scar trying to be hypertrophic or overgrowth. So I've been doing a lot of massage, trying to break up the collagen to prevent that, as well as the Kilo Coat and the silicone strips. So I saw my lap band surgeon. I had seen him actually on Tuesday night, because Tuesday night was support group, and he was there, and I was like, Thursday, I'm getting a fill. He was like, all right, he's like real funny. He's like, all right, we'll see. I was like, I'm getting a fill, for real. My appetite is back with a vengeance, and I can certainly eat a cup of food, no problem. I can eat bread. I've eaten rice. I've had pasta. Just trying it out, like seeing what can I really eat? And I can eat pretty much everything. I can't eat a large quantity of it because I do have restriction, but I don't have restriction to the point that I can't have certain textures, if that makes sense. So I am thinking in my head, driving down to his office this morning, I was like, I'm going to get 2 cc's. I'm going to talk him into 2, because when I had the complete unfill, he was like, we're going to take you back up slowly to 5 cc's, because that did seem to be my sweet spot. He said, but because you had the problem with the reflux and severe reflux, he was like, we're going to take you up in smaller increments than we did initially, so you don't have that problem again. So my first initial fill post-op was 3. They're pretty aggressive because they don't put anything in your band at the time of surgery. So when you come in, that 6-week checkup, you're starving. They hit you at 3, and that just really sets the tone of getting the ball rolling for your weight loss. So like I said, I'm getting my defense ready for 2 cc's. So we're talking, and he's like, yeah, I think we'll do 3. I'm like, 3? Yes. So happy, right? But then he says to me, it's a holiday weekend. We are closing early. We won't be open till Monday. And if you follow my videos, you know that the last time I had a problem, it was a holiday weekend. It was 4th of July weekend. And I had to drive 75 miles to Harrisburg, Pennsylvania, because my office in Hagerstown, Maryland was closed. Yes, and I had to work 4th of July weekend. Calling out on a holiday is like a no-go in most jobs, but in nursing especially. It's frowned upon. And because I've already been off 7 weeks for my belly, my manager would probably, lynch me or something, or at least try to. So I'm tired. As you can see, I worked last night, and it's 12 noon now, so I've been up forever, like 18, 20 hours. So let me just show you the belly, and just, oh, when I got up on the table, when he said he'd do 3, I like hopped up on the table all quick. I folded up my shirt, and he was like, wow, your belly looks great. And that's the second time he said that to me. There's a local plastic surgeon that does a lot in this area. I won't say his name, but maybe his work doesn't look as good as Dr. Katzen, because this is the second time Dr. Smalls has seen my belly, and he's like, he did a great job. So really happy about that. So let me show you the belly. And here's another uniform that's, you know, big on me. But as I said, I'll still be wearing these boys because I bought some stuff. I don't think I'm buying any more well, I won't buy any more right now. So, and I think Vicky is the person that asked me, and I didn't get back to you, Vicky, individually, but yes, I still wear compression garments. I wear the panty, well, it's a spank, but it's just the panty to under the bra. I actually wear a compression garment almost at all times except when I'm sleeping. At home, once I get home, I take off the compression garment. I take off the Spanx and I use the binder from the hospital when I'm just around the house. Actually, I don't like the way my stomach feels without the binder or without the Spanx on. I think I actually have more muscle spasms without it. So here's the belly, and he put a little band-aid because he always makes sure he protects my clothes. But he remarked that, he's like, wow, your port's really close to your belly button. I'm going to come closer and see if you can see the pin prick. See that little dry dot of blood? Let me see if I can get closer. You see that little tiny, whoop, right there. Oh man, I'm a hot mess with this camera. But that little dot of blood is where he entered the port. So he's right, it is pretty much right on top of my belly button. And you know what, it didn't even look like that in the photographs, the surgical photographs. It looked like it was more up here, but where he accessed the septum is absolutely right there. So here's my incision, almost non-existent from here to here.